The opinions expressed in this video are relevant for the most common kinds of conditions causing neck and back pain in adults. Those that occur through normal wear and tear and which are degenerative in nature, but are not appropriate for patients with infections, tumors, or rapidly worsening symptoms. The thoughts expressed here are not intended as medical advice for any particular patient. This video is offered as food for thought since many patients struggle with the decision of whether or not to undergo spinal surgery. Hello, my name is Mark Wolgan and I'm an orthopedic spine surgeon. I put together this little video so I could share some of my thoughts which are not meant to be taken as medical advice. You've got to check with your own doctor on that. But I'd like to discuss a little bit about how you decide whether or not you need spine surgery. The short answer is you never need spine surgery. It's all up to the patient to decide whether or not they want to go ahead. So here's the deal. If you have surgery, any kind of elective surgery, you're going to have one of three results. You're going to get better, you're going to stay the same, or get worse. You already know how you are now. The question is whether you're thinking of undergoing a surgical treatment that hopefully will help you feel better. There are some cases where I, as a physician and a surgeon, would recommend surgery. For example, here's a model of the spine. There's a nerve that comes out at every level. If the nerve were getting pinched to the point where the muscle were not functioning right, in other words, partial paralysis is occurring, I'm probably going to go on the record and recommend operative treatment because I don't think that gets better in a lot of times. If patients have compression in their spinal cord, in their cervical spine, and they're having trouble with fine motor movements, and they have a problem with their balance and maybe a problem with their bowel or bladder control, that's a different situation. And if the MRI studies show that you have spinal cord narrowing, I probably would recommend surgery then. But the vast majority of other times, it's really up to the patient. The patient will look to me after this whole discussion, they say, well, you're the doc, what do you recommend? And that's why I'm making this video, because it really is up to the patient to decide. If I could guarantee the result, I would take them kicking and screaming into the operating room and they'd thank me when it was done. But I can't guarantee the result. I guarantee I'll do the best I can. But when I take out my instruments and close the wound, it's up to the patient's biology to do the rest. Anyway, again, this is not medical advice. This is just my thoughts as one doctor taking care of his own patients. But I thought I would share that with you as maybe a point of consideration when you're deciding what to do. Thanks for watching, and be sure to look at my website, drwolgan.com. Thanks a lot.